Dr. G. Durga Devi, Professor and Head of Anatomy. I have more than 15 years of teaching experience, mentoring both undergraduate and postgraduate students. I have a passion for teaching, especially for the subject anatomy, and a special focus on osteology. And I'm the medical education coordinator for the institution, so I'm actively involved in contributing for the faculty development programs as well as implementation of curriculum. And I'm a life member of notable professional bodies in India. With that brief introduction, let us move on to the topic osteology of the mandible. Now let us see the ossification of mandible. The mandible is both endochondral or cartilaginous and membranous in ossification. The membrane is developed from the mesenchymal sheath, which is starting to develop on the lateral aspect of the cartilaginous part, which is known as the Meckel's cartilage, and the center for this develops by 7th week of intrauterine life. The objectives for today's class is, by the end of the session, the student should be able to describe the mandible under the following headings: the parts, the anatomical position, the external features, the ossification, the age-related changes, and applied anatomy of the mandible. So with that, let us move on to a little bit of introduction of the mandible. The word mandible is derived from the Greek word mandir, which means chew or masticate, and mandibula in Latin means the lower jaw. Some interesting facts about the mandible is that it is a U-shaped bone, a horseshoe-shaped bone, and it is the only bone that is movable in the skull apart from the ear ossicles. This is the anatomical position of the mandible. And coming to the external features of the mandible, it consists of the external surface, the internal surface. Now, the parts of the mandible consists of the body. This is the body of the mandible, and the two rami, the rami of the mandible. So let us see the features of the body of the mandible on the external surface. So this is the external surface of the body of the mandible. Now the most important aspect here is the union of the two bodies of the mandible in the midline. You can see a faint ridge in the midline, which is known as the symphysis menti. Now this marks the fusion of the two halves of the body of the mandible, and there is a triangular area which is present just below the symphysis menti, a projection which is called as the mental protuberance. The upper angle of the mental protuberance is at the lower point of the symphysis menti. There are two ends for this mental protuberance, and these are marked as a small projection, and they are called as the mental tubercle. So this will mark the mental tubercle. And you can observe on the external surface of the body a foramen here, which is present just below the second premolar tooth, or the junction between the two second premolar tooth, and this foramen is called as the mental foramen, and it transmits the mental nerves and vessels. Now an important line which is present on the external surface extending from the anterior margin of the rami up to the mental tubercle is called as the oblique line, and three muscles are attached to this oblique line. These are the depressor anguli inferioris, the buccinator, and the depressor labii inferioris. So these are the muscles that are attached to the oblique line on the external surface of the body of the mandible. So this is the oblique line which is present on the external surface of the mandible. Then there is a fossa just below the incisive teeth. So there is a shallow fossa that is present below the incisive teeth, and this is the incisive fossa. There is a shallow depression present below just the incisive teeth, and this is the incisive fossa. So these are the features that are present on the external surface of the body of the mandible. Let us see the features of the internal surface of the body of the mandible. Now the cartilaginous part of the mandible which develops all start with the letter C, that is the coronoid process, the condylar process, and the chin of the mandible in the body that is lying just below the incisive fossa. Now the mandible develops as two halves which is united in the midline, and this fusion is from below upwards, starts by 1 year of age and it is completed by 3 years of age. Now let us move on to the understanding of age-related changes of the mandible. In child, the mandible is almost like a shell having the sockets, alveolar sockets, for both the deciduous as well as the permanent teeth. And the angle of the mandible, which is the junction between the posterior border of the ramus of the mandible and the body of the mandible, the angle formed is about 140 degrees, and the coronoid process is at a higher level than the condylar process. The mental foramen that you observe on the external surface of the body of the mandible is present closer to the lower border of the mandible. These are the points to identify it is a child mandible. Now going on to the adult. In adult, if we observe, the sockets are well placed and the depth of the alveolar part and the subalveolar part are almost equal. Here again, the condylar process is at a higher level than the coronoid process. The mental foramen, this mental foramen is midway between the upper border and the lower border, and the angle formed in the adult mandible is about 110 degrees. Now coming to old age, if you see the alveolar sockets are almost absorbed and it is smooth. The neck of the mandible is bent behind such a way the coronoid process becomes at a higher level than the condylar process, and the mental foramen is present at the upper border, close to the upper border of the mandible. The angle of the mandible is about 140 degrees. These are the age-related changes that we have to understand with respect to mandible. Now we will see about a few applied aspects of the mandible. Now mandible is a very prominent facial skeleton, so it is susceptible for fractures during violent injuries, and this can cause usually fracture at the angle or at the neck of the mandible. However, the periosteum of the mandible is quite strong and this does not allow any displacement of the fracture bone. The other aspects that we have to understand is the osteomas or the carcinomas involving the mandible. This can be called as odontomas, which develop from the growing teeth, or also called as ameloblastoma, which develops from the embryonic cells of the growing teeth, and other osteomas or carcinomas of the mandible are also common. So these are the applied anatomy of the mandible. Now the internal surface, there is again a line which extends just behind the third molar tooth and runs downwards and forwards up to the digastric, lower border of digastric fossa. This line is called as the mylohyoid line and gives attachment to the mylohyoid muscle. Now, the other important aspect here is the posterior part of this below the mylohyoid line, this fossa or a depression, that is the submandibular fossa. Submandibular salivary gland is present or related to this fossa. The facial artery is also lodged in this or related to this fossa. So this is present posterior and at the lower part of the mylohyoid line. And just anterior and little above to the mylohyoid line, there is a shallow depression fossa here, and it is related to the sublingual salivary gland. So these are the features that are present on the internal surface of the body of the mandible bone. Now coming to the border of this body of the mandible, we have the superior border, that is the upper border of the mandible, and these have the various sockets for the teeth, and there are about 16 sockets, and each of these sockets may be single or they can contain partitioned by a septate. So this is the alveolar part or the upper border of the body of the mandible. Now the lower border of the body of the mandible, this is the lower border of the body of the mandible, and along the midline, on either sides of the midline, there is a depression on either sides. This is known as the digastric fossa. It gives attachment to anterior belly of digastric. And the lower border of the body of the mandible also gives attachment to the investing layer of deep cervical fascia and also the platysma muscle. So with that, we finish the body of the mandible. Let us move on to the ramus of the mandible. So this is the ramus of the mandible. This entire portion is the ramus of the mandible. It consists of a lateral surface, medial surface, superior border or the upper border, the lower border, the anterior border and the posterior border, and there are two processes on the ramus. Anteriorly, a triangular process which is called as the coronoid process, and posteriorly the process is called as the condylar process. Now coming to the lateral surface of the ramus of the mandible, the postero-superior part of the ramus of the mandible gives or is in relation with the parotid gland, and coming to the medial surface of the ramus of the mandible. Medial surface presents a important foramen that is called as the mandibular foramen. Now this mandibular foramen, it continues into the body of the mandible as the mandibular canal, and it transmits the inferior alveolar nerves and vessels. There is a tongue-like projection just on the anterior margin, of this mandibular foramen, and that is called as the linguala. The linguala gives attachment to sphenomandibular ligament. There is a faint groove which runs down from the inferior point of the mandibular foramen, and this groove is called as the mylohyoid groove. It lodges the mylohyoid nerves and vessels. Now the part of the area that is between the mylohyoid groove and the angle of the mandible, you can appreciate some ridges. This is for the attachment of medial pterygoid muscle. Now coming to the superior border of the mandible or the upper border of the mandible, it is a thin plate and it forms a notch which is called as the mandibular notch or the incisura, and this will transmit the mesenteric nerves and vessels. So this is the superior border of the ramus of the mandible. The inferior border or the lower border or the ramus of the mandible is continuous with the base of the mandible, and posteriorly it is continuous with the posterior border of the mandible, forming the angle of the mandible. the anterior margin of the ramus of the mandible. It is continuous above with the coronoid process, and it gives attachment on the medial surface to the temporalis muscle. This is the posterior border of the ramus of the mandible, and the upper part is related to the parotid gland. Now coming to the two important processes of the mandible here is the coronoid process and the condylar process. The coronoid process is a projection, triangular projection, the apex of which gives attachment to the temporalis muscle. The condylar process, which is expanded side to side, it articulates with the temporal bone of the skull to form the temporomandibular joint. The constricted portion just below the head of, this is the head of the condylar process of the mandible, and the constricted portion is the head of the mandible. This is the condylar process, which is expanded from side to side. It articulates with the temporal bone of the skull to form the temporomandibular joint, also the head of the mandible. The constricted portion just below the head of the condylar process, that is the neck of the mandible, and it has few important features. Anterior to the neck, there is a pit or a depressed area that is called as the pterygoid fovea, which gives attachment to the lateral pterygoid muscle, and medial aspect of the neck of the mandible, maxillary artery and auriculotemporal nerve is related to the medial aspect of the neck of the mandible, and this is what is more prone for fracture, and there can be injury to the auriculotemporal nerve and maxillary artery. So with that we finish the various processes, the borders of the ramus of the mandible. Now coming to the ossification of this bone or the mandible is that it is both membranous and cartilaginous or endochondral in ossification. So the membranous part is derived from the mesenchymal sheath, which is present, or it starts to appear on the lateral aspect of the cartilaginous part, and the cartilaginous part is the Meckel's cartilage. This is the lateral aspect of the ramus of the mandible. The postero-superior part is related to the parotid gland, and the rest of the aspect, lateral aspect of the ramus of the mandible gives attachment to masseter muscle. The junction between the ramus where it meets the body of the mandible is closely in relation with the facial artery and vein, artery being anterior and vein being posterior. Facial artery is present anterior and facial vein is present posterior. So other important feature on the body of the internal surface of the body of the mandible are, in the midline there are two projections, one on the superior, which is called as the superior genial tubercle, and one situated below that is the inferior genial tubercle. The superior genial tubercle gives attachment to genioglossus, and the inferior genial tubercle gives attachment to geniohyoid muscle. With that we conclude this session on osteology of mandible. I will soon meet you in the next interesting session. For questions, please drop it down in the comments.